Good morning, all NYP followers, pet parents, and also people that are deciding whether they want a pet or not. And this topic is so important because we're talking about pet loss grief. And I would love to introduce this incredible lady, Jessica Moore. She lives in Toronto and I live in Hong Kong. And I'm right now at an airport hotel in Malaysia. I contacted Jessica after hearing her speak at a conference. And I thought, gee, I wish I knew all this 10, 15 years ago when I lost, as an adult, my first pet. And I feel that we in Asia, this region, India, Asia, China, there is such a huge movement towards love for pets, adopting pets, but we have not yet, we don't still know how to navigate the inevitable when we have pets. And pet loss grief will be inevitable. So, hello, Jessica Moore. Thank you for being here. I'm so glad you made yourself available at at whatever time you gave me, and you really at last minute. I would say this wasn't even planned. This was just planned perhaps a month ago, and you were so willing, and I really thank you for this.
Thank you for having me, Nita.
You must be freezing out there in Toronto. Well, I know
It's
you
so
have
cold.
heat waves.
It's so cold.
You must be having
We have
snow.
snow and cold. It sucks.
Well, I don't want to make you jealous. I do love the snow a lot. But it's lovely out here in Malaysia. The weather has been divine. It's nice and breezy, and Hong Kong will be the same. But yes, we travel a lot to see snow because it's always fascinating.
For
So
sure.
Jessica Mall is a certified pet loss grief specialist counselor, certified through the American Academy of Grief Counselors, and a registered veterinary technician licensed through the Ontario Association of Veterinary Technicians with over 20 years of experience in small animal medicine and grief support. Having witnessed countless clients grieve in silence, Jessica was inspired to pursue formal certification in grief counseling to help pet owners process their loss with the care and the validation they deserve. Her approach is deeply rooted in both professional expertise and personal experience, having navigated profound loss herself, including the passing of her beloved companion, Mr. Tor, whose unconditional love was a source of strength through life's hardest seasons. And truly, those out there of you who have pets know how pets are there for you during your darkest hours. Jessica strives to create a world where grieving pet owners never have to walk through their loss alone. Thank you, Jessica. All your website, your email, Instagram, we will all put this on the website for anyone after this conversation that I'm going to have with you. So when they want to learn more about what you do, which is a new concept in at this part of the world still, and if they want to get in touch with you, this will all be displayed throughout our talk and also on our website. Jessica, I would love to say a little bit about myself before I start asking all these important questions that I wish were answered during my time. So I grew up in the Caribbean, a beautiful Dutch island in the 60s. My parents had a house with a garden, and I grew up with lots of pets. Oof, from poodles to chihuahuas and Pekingese, and then German shepherds, Akitas, boxers. I grew up with a lot of pets. When a pet would pass away, I would be in school, for example. I'd come home and the pet is not there. And my parents never discussed it. Sometimes I would find a new pet in the house and I'd say, oh, what happened to the other one? And, oh, that one went away. And immediately my parents, with not enough knowledge and from their own experiences, they felt, oh, replacing a pet that you lost, it's so easy to get another pet and that's it. The grief is done with. I don't know. I've never spoken about this with my parents. I was so little. I never asked them, how do you feel? Do you sometimes miss Souffle, for example, the poodle? So it was unspoken.
Yeah.
And because we had so many dogs, but of course, even talking about the first pet, Souffle, and all the others, Goldshoe, obviously as a little child, I can't forget them. But what happened as an adult, living alone, now I have 6 beautiful pets at home right now with me in Hong Kong. I live alone. And that pet parent or guardian bond has become now in this generation, in a lot of cases, one of the strongest bonds that people have with other living beings, especially the elderly or a teenage kid at home, even parents, working parents. So when I lost as an adult my first pet, I wasn't in Hong Kong. My father had passed away, so I had to go to my island. My first pet passed away, was attacked by another dog, and that grief, I couldn't, I was lost. And where did I find solace? I never knew there was something as a pet loss grief counselor. I found solace in alcohol. And that was, needless to say, it didn't help.
Yeah.
Then in 2022, I lost the second one, Gina, my little Yorkie. I wasn't in Hong Kong. I was with my mom, keeping her company on my island, but that case was different. She needed emergency surgery. Immediately I had the surgeon, and on camera the surgeon finished the surgery. She looked at me, she made me look at Gina, and she says, Nita, I don't think the surgery went well, and I think it's best to let her go. And I said, what are you talking about? I can see her. She's breathing. She's looking at me on the camera, even while she was on the table with her oxygen. Surgeon said, Nita, and she used one word. She said, please have compassion for Gina. And all she had to say was that a wonderful surgeon, I had the best veterinarians and surgeons. And she said that word, and I'm sitting thousands of miles away, and I had to say yes. And I watched Gina get the injection and go. Jessica, that broke me. I still remember falling on the floor after that and crying to the extent where I couldn't cry anymore, and there was this howl that came out of me, a howl. Why? Because now I had to make a choice, not choice, a decision to euthanize. And for months, it haunted me that I took someone's life. And I spiraled into a deep depression for about 4 or 5 months. And that's when my daughter saw me going downhill, and she said, Mom, I went online and I found something called a pet loss grief counselor. So in 2022, I found an incredible lady called Kate McGann, and she's written several books, and she counseled me through this and held my hand. And if it wasn't for her, I don't think I would have gotten more pets. I don't think I would have found more love in my heart because I couldn't handle it. And the work that she did and the work that you do is huge, because that grief, there are no words for that grief. And we will go into that now. And I want to say, I really feel that this is something that we need here in the East because of our culture. when we lose a pet, we we don't grieve openly. People can relate because everyone
Sure.
who have pets, they do, but it's not yet out in the mainstream where they can relate to the extent that they wish they could or get help.
Sure.
So that's my little bit where I wanted to tell you where we are coming from, and not only us, also other cultures that live in the West. I mean, you have also
Sure.
Asian cultures that live in the West. So I'd like to ask you, Jessica, you know, what started you off on this journey? I mean, tell us a bit about your story of Mr. Tour. I really like to know this pet loss grief counseling. How did that start with you?
Yeah. Well, Mr. Thor was a part of it for sure. I went on a bit of a personal medical journey first that kind of inspired it. But a number of years ago, I was working in an animal hospital, very busy day, lots of surgeries, my favorite kind of day. And at the same time, though, I was experiencing four very close family members were all going through cancer treatments of different kinds. So I was pulled in every direction. We had managing the animal hospital, having young children, parents potentially passing away soon or going through heavy loads of chemo and appointments. And one day I'm in the hospital, and all of a sudden I had what kind of looked like a stroke-like episode. So they call the ambulance, I get to the hospital, they bring me up to the stroke unit, very classic symbols and signs of a stroke. But I put me through MRI machines, did all the blood testing, nothing wrong with me at all. So I ended up flying somewhere else in the world to get more help. I wasn't getting enough treatment here. I wasn't getting it fast enough. The episodes started happening more and more. I had acquired a disability with my right arm and hand. I couldn't use it properly, but they just couldn't pinpoint what it was. So finally, I ended up getting diagnosed with something called a functional neurological disorder. And basically, what this is something, unfortunately, that's not very well known in the world either. But what it is, it's a situation where you have so much sub-impacted trauma in the back of the brain that your body tries to find a way to prevent anything else from coming in. It's like a protection mode. So it's an actual physical slowdown of blood flow in the back of the brain beside the trauma center that was basically causing me this disability, causing these episodes. And it was all due to unprocessed trauma. And so, I had a multitude of things happen to me, growing up, from childhood all the way to adulthood that, I think as a child, I found a very interesting way of protecting myself emotionally and finding ways to kind of self-process that weren't really processing. And after so many years of, certain levels of trauma and now this current state of life where things felt inevitably out of control, my body finally said that's enough.
Mm-hmm.
And so this transition took me away from inside of the animal hospital. I was very heavily in surgery and anesthesia and teaching, and this is not something I can do with one hand, right? And so I too was going down a bit of a deep, dark depression hole of, realizing too that the animal hospital my whole life, I used that also as a coping mechanism. I worked 12, 14 hours a day, didn't care if I wasn't even paid for it. It was the safest place I could be, right? That was my home, but I was hiding from processing trauma properly, right?
Mm-hmm.
So I ended up going through some very specialized psychodynamic psychotherapy, which helps basically kind of unblock that portion of the impact that's sitting in the back of the brain, along with some specialized physio. And while I was going through this, I'm thinking, okay, but now what, right? What does my career look like? Since I was 15 years old, I have been living and breathing in the animal hospital. I don't know what else would possibly fill me up. So I started doing some research about what else I could do in the industry, how I could still connect with people and pets and my expertise. And I realized, through my actual personal therapy journey, I realized that one big part of the animal hospital that I actually loved the most was having those clients who follow you around from hospital to hospital, Fluffy from puppy till 15 years old. And as much as, nobody wants to deal with that end of life process, I always found a comforting part of that process with those clients where, even if they weren't people who followed me around for 15 years and I was just treating their pet for 2 years, you just build these bonds with these people. So, they come in and now is the last day that they have with their pet and they're so unsure about what's going to happen and how they're going to feel. And is it okay to act a certain way? But I always felt like I was able to connect with these people on a level where they felt okay to speak to me about those feelings, right? Or at least start to, right? Ask the right questions. And we built an even stronger bond in the last hour of that pet's life, right? And I always felt when I came out of a euthanasia, I felt connected, bonded, sad, but also very fulfilled. And I think that fulfilling part was knowing that I was able to provide some sort of, calm or comfort to somebody going through probably one of the hardest days of their lives. Right. And, I'd also worked in so many animal hospitals in the past where, you see some really good things and you see some really bad things. I've seen some very unprofessional veterinary professionals who, are not compassionate at all when it comes to end of life process. And it's usually because they're also uncomfortable, right? They're not really comfortable with that process, even though it's a huge part of their job. So they keep the emotions out of it. They try to just be professional and put a face on, get the euthanasia done. And that client leaves even more distraught than when they came in, right? Which is not the purpose. So that all kind of got me going down the path of, maybe I can help people in a different way. And so I did a bunch of research. I learned about pet grief counseling in a way of through the American Animal Hospital Association. And I thought to myself, let me see what this program is about. And so I spoke to the director. He said, this is not something a lot of people take. It's not a course that a lot of people like to go through. But I'm here for you to support you however you want to. And sure enough, as soon as I got into the courses, I felt so fulfilled. I felt like I finally found my calling. Maybe this is a way that I can actually use my expertise, my knowledge, my compassion in a way that's not just meaningful but missing. You spoke a lot already about how it's just not really a normal thing on that side of the world. Well, I'll tell you, it's not here either. It is more normalized here for sure, but there aren't pet grief counselors everywhere. And I'm sure you've noticed that in your searches as well. It's very few, far between.
Yeah.
And, that was kind of my, felt like I finally found a new calling, So I put myself through the schooling. Just before I started the schooling as well, during the therapy, my dad was going downhill pretty quickly. My sister had cancer. My grandparents were just diagnosed. It was a very troubling time, and inevitably, Mr. Thor, unfortunately, was becoming a little less capable himself. So Mr. Thor, he was with me for 11 years.
Is he a cat? Your cat?
No, he's a dog.
Okay.
Dog, yeah.
Yeah.
And so I got him. Is that kind of a funny story? Actually, I actually went to a specific breeder that I worked with in the animal hospital who brought these dogs from Portugal. He bred them. They were herding dogs. He either trained them to be on farms or he trained them to be domesticated dogs in a house, and I just fell in love with the breed. So I said to one, 11 years ago, I went and showed up to this farm, and I was all excited to see him. And I pull up to this farm, and something didn't feel right. And I look a couple ways, and I see a couple farms, pull into the driveway, and this gentleman comes out, and it's not the gentleman I'm used to dealing with. And sure enough, I pulled into the wrong driveway. It was actually the gentleman's brother, who also bred this kind of dog as well, but it wasn't him. And so I went in, the conditions weren't as nice as I expected. The dogs were a little aggressive and on edge, and it was a little strange, but all of a sudden my heart gravitated to, I don't think I can leave here. Like, I think some creature here might need my help. And so he opened the gate of where the dogs were, and all these puppies come running out, all happy to see me. And there's Mr. Thor in the very back corner, hiding like this, covered in pee. And he just looked at me, and I said, what about you? And he comes running into my arms, and I said, oh my goodness, I have to take this one home.
Yeah.
So that's how I ended up with him. Unfortunately, due to the poor breeding, he had inherited well, not inherited, he was genetically inclined with a poor condition called degenerative ligament disorder. So basically, at a year old, once his ligaments had fully developed, they had already started degenerating. And so at a year old, we're running in a field, and he just stops and sits down.
I think your camera froze, Jessica. Your camera froze.
Yeah, it did.
Yeah. Okay.
Good. Okay.
We're good now.
So yeah, about a year old, we're running through a field, and all of a sudden he collapses. I take him into the animal hospital, do a quick X-ray, and I go, oh my God, what is this? And so long story short, Thor was a bit of a bionic dog at the end. I mean, we did a multitude of reconstructive surgeries to, basically rebuild his two back legs. He had orthopedic braces his whole life, but he did very, very well. He was a very, very happy, very grateful to be alive kind of creature. And, we embraced it as much as we could. But all that being said, I made a very strict promise to him, which was the second that mobility was a problem, like a real problem, beyond what we were already doing, where medical intervention would be a little bit outweighing quality of life, that I would decide to euthanize. So right around that kind of sensitive time of everything happening, and while I was kind of deciding on trying to switch this over in regards to career, Thor unfortunately was losing his mobility. And so one morning I woke up, he got up, did his usual routine, of waiting for me to get out of bed and being all excited, except everything was slower and harder. And I went to walk to the bathroom, and I hear thud. And I look back, and he had fallen on his face. Gets back up, tries again, fallen on his face. I said, oh my goodness. So we went through this for just a couple of days, and I quickly realized and decided that it was time to honor my promise to him, that I would not let him suffer, and I would not put him through more. And I would decide to, make that day come. So it was unfortunately in a very close timeline, in tandem with my father going downhill as well. His diagnosis got grave very quickly. I got a call right around the same time from his head surgeon, and he was stuck in hospital at this point. And I was asked for consent to euthanize him as well. And, I will never forget the moment of getting off that phone and saying to myself, like, I told him, I have to call you back. I can't do this right now. Then I felt, of course, guilty about that. They're sitting here trying to make an important decision, and I need to call them back. Well, it doesn't matter what kind of experience I have. Now I'm the client, I'm the human, the owner in that position where I'm going through it too, right? And all of a sudden I have to make two decisions to euthanize two incredibly important people in my life, or, creatures in my life at the same time. Right. And it was awfully confusing and troubling. And I did get some counseling around that time. And I did have to make those calls and do the right thing for both of them. But that moment is what really expedited my decision to move forward with that path, because I realized that no matter how hard it was going to be to focus on anything or try to accomplish something new while you're going through all of this, I felt like, Jess, you have so much knowledge and experience around this topic, comfortability talking around this topic, you're not scared of it, and now you have to process it yourself. Let's do this through school. And so I use that as an aid. And I think I made the best possible decision I could, given everything I knew at the time and not knowing which direction I did not want to fall into. And that's kind of what pushed me to the edge of that choice.
Absolutely. When you go through it, you've gone through it yourself, and when that happened to you, you realized when it happens to you what other people experience, and you can relate so well, and you've turned this deep loss into a very important purpose, Jessica. I think that's very important purpose. Um, Here, before we start with, I want you to explain to us what makes pet grief different from other types of grief, and why is it so often misunderstood? What makes it different?
Well, I think the biggest thing that makes it different is for me personally. I mean, again, we have to remember everybody has different beliefs and values and morals. But for me personally, what I think makes it the biggest difference is the fact of how how you process that bond. So, when we bond with an animal, I find it's a different personal deepness and connection because it doesn't matter, what you say or who you are or what you do. They love you no matter what. I mean, maybe they can't say any words, right? But is that maybe more powerful? Absolutely. I mean, you could make the biggest mistake of your life where even your most closest confidant, your best friend, your mother, your whoever you usually go to will need to give you, some very hard advice. Sometimes not things you want to hear. Sometimes you're not ready to hear them, right? But when you have your companion beside you who's a pet, who loves you unconditionally, who doesn't look at you any differently, no matter what you did that day or what the situation was that happened, you can't tell me that's not a deeper way to connect with a being, right? I've never in my life been able to experience love in that way. I am so grateful to, have a partner who's quite literally the love of my life. But I can't compare that love to the love I had with my soul companion, Mr. Thor. Like it's not replaceable, right? The unconditional, unjudgmental, there for you all the time. It's just so special.
Those words are exactly how I feel also. See, I was an only child for 13 years on my island. My little sister was born when I was 13 years old, and I'd come home from school and my parents were always working. So my companion was always all these, and we had a big garden, and I'd be in the garden all the time with the pets. But as an adult, when my first pet passed away, and now I'm an adult, right? Luca, my father passed away in Curacao. I had to be there with all the ceremonies, the funeral, everything. And then I was dealing with that grief. But 2 months right after that, Luca passed away. Or I don't like to use the word pass away anymore. I like to say transition because I've come a long way now. Transitioned. And when Luca transitioned, I was ashamed to express that I cried so much more for Luca. Of course, I was very sad that my father, transitioned. I was, but there is a different relationship. And like you said, I did not know why. And I was thinking, why am I crying so much for Luca? Is this a compounded grief that's now coming out? No, it wasn't compounded. It was literally that unconditional love that I got from Luca. And when Gina also the same thing, the worst part is you walk through the door of your house, and where is he to greet you at the door? and no attitude, doesn't ask you where you've been, or you promised you'd come home and
Yeah,
pick me up and take me here. Those are all great. I mean, your children, you want to feel needed, and
of
you love
course.
your children, you love your
Just
parents,
different. It's
but
just
it's
different.
so different. It's so
Yeah.
different. And I have to tell you, Jessica, you'll be very proud of me to hear this, but having done that grief counseling with Kate McGann during Gina's time, because I had to make that decision to euthanize,
Yeah.
my golden retriever, 16-year-old golden retriever, beautiful 16-year-old, he transitioned last month. But just prior to all that, I was listening to you. You were at a conference, and for the first time, it had been a while, that
Sure.
I hadn't listened to about grief counseling.
Yeah.
So when I listened to you, I was like, oh, I know Oliver is going to get there pretty soon because you know the signs.
Of
And we're going
course.
to talk about anticipatory grief. And you will be so, you know, glad to know that I took all the notes of what you said all over again. It registered, and I said, gosh, I forgot all this. And thank God I'm listening to Jessica Mock. She's already preparing me now. And Ollie transitioned a couple of weeks after listening to you, and I applied everything you said because I had to make the decision to
Yeah.
euthanize him. And look at me a month later. This is not the same person a month after Luca or a month
No.
after Gina. A month after Luca, I would be drinking vodka. A month after Gina, I wouldn't get out of bed at all. No, nothing could get me out of bed. And
Yeah.
now, and it's going to be my first Christmas because we're now in December without Ollie, without this beautiful golden retriever at the door. And it doesn't matter how many pets you have. I have five more, but you love all of them so much.
Yeah.
It's going
Maybe
to
one
be
doesn't replace another. You
no, it's
still
going
miss.
to be yeah, and it's going to be the first holidays without Ollie after 16 years. So, so the work that you do is really for pet parents. I think it's very, very important. In Now, here's another question: how can someone know if they're stuck in grief or experiencing complicated grief, like we've just talked a bit about?
I don't think either are different, to be honest with you. It's just a different stage of grieving typically, right? I mean, people being stuck in grief are typically feeling stuck because they're not getting the right help, right? They're not asking the right questions. They're not allowing themselves to feel validated about their feelings. Maybe they're not even surrounded by people who are enabling them to validate their feelings. I find a lot of the times that's what it is. It's not typically they don't want to feel. Now, sometimes it is. It depends on how you were raised, where you were raised. Like you just said, right? When you were younger, you didn't really know how to validate those feelings. It wasn't really talked about. It wasn't really allowed. It wasn't really maybe culturally accepted, right? It was kind of like, Nita, seriously, you're still upset? Like it's just a dog. Get over it, right? I mean, we have three more. Come on,
Yeah,
go play with the dogs,
yeah.
right? And so that stuckness is typically due to lack of validation, one way or the other, right? Opposed to complicated grief, where, to be honest with you, it can be the exact same situation versus I'm just taking a little bit longer to get through a certain stage, maybe because I haven't been able to get the appropriate help I need, right? Maybe you just can't do it on their own, right? A lot of people think like, even when a human dies or a pet, any kind of grief, right? A lot of people think like I'll get over it eventually. I'll get over it eventually,
Yeah,
right? And they get stuck in that convincing themselves
yeah.
mode instead of maybe I should try something different to see if I can get out of this stage and move into a healthier space, right?
I feel that it gets really complicated. See, there's one scenario where your pet just sleeps. Well, I have had one of them just
Sure.
suddenly transitions in his sleep without being sick or anything. So that's
Sure.
Andre. Yeah? And that's why I didn't even mention Andre. Andre was a meditator. He was in Zen mode all his life, and he
All
was
the time.
already 14 years old, little Yorkie.
Yeah.
And And he transitioned very calmly. He ate normal, he walked and transitioned very calmly in his sleep. But I believe when it gets really complicated is when you have to euthanize, and that's where, oof, now it's not only you've lost your beloved, really strong companion, but
Yeah.
now the guilt of having made that decision. So
Yeah.
these are huge. It really compounds the grief even more. And so
Yeah,
pet
exactly.
parents face these challenges on making the decision. Now, how how did you explain so well last time when I listened to you, because it was my first experience where
Sure.
now I'm in front of Ollie, in front of him, and not miles away, and
Mhm.
I have to make that decision. So, how does one approach this? Let's say the vet says, you know, um, Molly, your little doggy, I think this is it. We can't do anything more.
Yeah.
How does one approach this?
Well, I mean that's a very individual thing, right? It's not a generalized answer for sure. I think to start, it's we have to understand that from evolutionary time, it is not a normal thing for humans to make a decision to end a life,
Correct.
right? That is not something that we almost feel that we should be a part of. It's kind of wrong, right? Why would I be decide? Well, it's a wrong feeling to us. It's not normalized, right? So why would I be the one to make that call,
Yeah.
right? Why would I be the one who be a part of that decision? Why shouldn't my pet just go peacefully on their own, maybe transition in their sleep, like you said, right? And I think the biggest thing here is you have to sit back and you have to take that part out of it and you have to make a qualified decision based on your scenario, right? So all the information you have in that exact moment, you have to make the best call for you and your pet, right? So I think it's important in that stage to understand, how sick is my animal? How much is my animal suffering? Is if the prognosis is grave, what would be the benefit of keeping this pet alive, right? And typically, when we go through the motions of those questions, we quickly understand that, in veterinary medicine, we have a very unique gift of being able to make those decisions and end suffering and end, that inevitable send the dog home and a traumatic way, something traumatic happens at home instead, and then we're in a point of crisis and we don't know what to do, and then we feel even more guilty, right? So I think it's important to ask a lot of questions so that you can really understand at what stage of life your pet is currently in. What does quality of life look like for them moving forward from today on, right? And are we just deciding to divert away from euthanasia because we're uncomfortable with being a part of the decision? Or are we diverting away from euthanasia because it feels wrong, right? And in those situations, often if the pet is not in grave illness and it would be not harmful for them to be alive for X period more time, I do recommend people trying to reach out to a grief counselor, and trying to ask the questions they need alongside their veterinarian, if they're the right, personnel to ask that, if you have that relationship with them, because some people don't, right? And try to get all those feelings and decisions justified before you make that decision. Now, we don't always have the luxury of time, right? We have accidents that happen right in the moment, and we just hope that wherever you end up, let's say in an animal hospital with whatever veterinary professional, we hope that you end up with somebody who is compassionate and willing to take time, even in the middle of an emergency, to answer those few questions so we can normalize it just a little bit more, right? Because even once you have those questions answered, it doesn't mean you're going to walk away and not feel a form of guilt towards what just happened, right? But if at least we understand where that feeling is coming from and our feelings have been validated and that decision has been validated, then it can be a little bit easier.
Absolutely. Validation. It's such a heavy decision to make on your own. And I have to say again, I was so fortunate to come across when you spoke on the conference,
Yeah.
because Oliver was struggling by then, and this is the anticipatory grief where
Yeah.
I had prepared myself already, knowing he's 16 and he's now struggling, that this might be Ollie's last Christmas, or this might be Ollie's last year. So I was anticipating it for 2026.
Right.
However, 2 months ago, I had just finished listening to you and I saw Ollie now. I kind of knew something is definitely beyond this. So he was eating normal, loved going to the beach still, but I saw him struggle. So I took him to my veterinarian. I have two, they're partners down the road. And the way you explained it at the beginning of this chat that I'm having with you, yes, you could be the best veterinarian with all this knowledge, but the compassion that the veterinarians give, that's on a complete different level, and that is so important. So these two had known Ollie for years and years, since he was a baby. Well, one of them, of the two. And they looked at Ollie, and to make a long story short, the one that was on duty looked up at me, and her eyes were watering, and she says, Nita, we believe Oliver has cancer. And I'm saying, with a little bit of self study and listening to, I had just listened to you that week.
Mm-hmm.
I looked at the veterinarian. I was calm, as calm as I could be. I looked at her, and she's wonderful. And she says, it has spread. We can feel it. I don't think surgery is an option at this time. So I was getting the information that I needed. She was so compassionate. And I said to the veterinarian doctor, I'm not going to make that decision now for Ollie. The most important thing is he eating well? Yes. Does he still enjoy life? Yes. Do you see anything unusual? No. Is he in pain? That was the most important. I said to the doctor, do you think he's in pain? Well, she checked him out and she goes, well, he doesn't seem to be in pain. So I said, then when the time comes, but in the meantime, I would like to take him home and see how it progresses. And she gave me all the pointers to look out for. And
That's
here
great.
comes my question. I did not know, and really call me really ignorant or tell me, Nita, in what world are you living? Honestly, I myself don't know, but there are two words that were very new in my life: palliative and hospice.
Mm-hmm.
And I immediately sought guidance from this incredible lady called Gail Pope, who talks about hospice. Can you talk a little bit, because that is also so important? Just because we have a terminal situation on hand where we don't know how long our dog or cat or pet or parrot is going to continue on. I mean, there's still the option of bringing your pet home, right? And now, can you please explain to us the difference between palliative care and now the difference between hospice? Enlighten all of us.
Yeah. Yeah, I mean, it's maybe something newer, like you said, for a lot of people in the veterinary world, that's for sure. Pet owner world anyway, opposed to, human medicine, because obviously that's something we've had to utilize because we don't have euthanasia on that front, right? But yeah, so palliative care, typically is decided upon when, you're given kind of a long-term, could be a long-term or a short-term chronic illness, right? There's usually medical intervention involved, along with the obvious, providing comfort and care, spirituality, all of that. But there's always kind of a medical intervention route involved with palliative care. And you could still transition from one to the other, right? But the core difference is, hospice care is pretty defined as, you've got the grave the grave prognosis, let's say we know Ollie has, 2 months to live. I really, want to make sure that, yes, he's not in pain. But if you're telling me that he's not in pain and I'm able to provide him, comfort and care without medical intervention or treatment, to live out the best case scenario for him, then that's what we'll do. So it's kind of medical intervention versus not, right? But still
Right.
both very supportive when it comes to a lot of people find like the spirituality in that one. I feel like a lot of people in those stages, they typically jump into speaking with animal communicators
Yes.
alongside pet grief counselors, right? Because sometimes they want to get some kind of signal to know that they feel like that can validate the feelings of what these decisions are going to be so that they can be sure they're not choosing suffering alongside a palliative or a hospice, especially the hospice, right? Because we're taking away all that, medical intervention for pain management and everything else, and we're trying to let things be a little bit more natural. And so, validation of those feelings are very important at that time, or maybe having that communication intellectually with the animal to say, I think I'm making the right call. But yeah, it is something that's less utilized in the pet world for sure. But it's important to keep in mind because, you don't always have to jump to euthanasia.
No, no. And I was really lucky because, again, euthanasia is sort of normal on this side. It is.
Yeah.
Hospice is not. I wouldn't. I don't know even. It's not even a conversation that we have here. Oh, my pet is terminal, so I'm home taking care of. It's not really a conversation that I heard. So I was very fortunate that I had a lot of support from my veterinarians. I could call them, obviously not at odd hours, but I would say, okay, Oliver's, I would leave my number behind and they would call me whenever they had a chance. And I'd be like, Oliver's peeing longer than and much more than usual. Okay, so we went through this journey together. Now Oliver's not standing up to pee, but is he in pain? No.
Yes.
So that hospice care was 6 weeks, but I'll tell you again, Jessica, having listened to you, um, we made those 6 weeks so beautiful along with his other 5 siblings and my lovely, housekeeper who takes care of the pets with me. I would drive Ollie to the beach, and Goldens, they run and they'll run into the water, and my beach is only a 7-minute walk, but Ollie could. He comes in the car twice a day. All the pets come in the car. Then we go to the beach. Ollie stopped even approaching the water, but he would love to sit in front of it and just gaze at the water. He would enjoy it, and he had his tail always wagging. And I still remember Ollie, where we would have to beg him to come out of the water because golden retrievers love swimming.
Oh, yeah.
So, but that tail was wagging. And the last night, I was sleeping with him in his doggy bed because he couldn't come up on mine anymore. And that night, and he has so much dignity. That night, he just couldn't hold it. He would normally stand up. He would by then already start peeing around the house. He's not going to hold it for his normal, go out and come. And that was okay because that's part of his, end of life, experience. But when he started peeing in his doggy bag and I was all wet with him, I knew this is now not okay. I got up in the morning. Ollie got up and was drinking water from his pet bowl. And I think it's so important when you said animal communicators. I feel I'm not a certified, I don't know if you have to be certified to be an animal communicator because honestly, Jessica, everyone can communicate with their pets if they just, practice it a bit. We all can, and we just need to be just told we all can. It's not something you need to go and study, right? I mean,
No, I mean it's really about beliefs, right? And having an open
yeah,
mind.
yes,
If you like you just said, if you think about it, we're doing that all the time with them, right? We might be the ones speaking out loud. They're not speaking back, but we're communicating with them on an intellectual level all the time. And who is better to be gauging the quality of life scale every single day at that end of life stage than you, right? No one can.
no one can.
No one
And
knows your pet the way you do, and no one is bonded and has that companionship the way you do, right? So, you can really be your own form of medicine to them, right? If you allow your mind to.
correct. So I had I looked at Ollie, and he was drinking his water, and he looked up at me, and I'll never forget his beautiful eyes. And his eyes looked at me, and he says, "Mommy, I think I've had enough now, Mommy. I think it's time." I can say it without tears in my eyes because I know that's the only validation I needed from him.
Yep.
And I made a call. It was morning. I made a call to the veterinarian, and she also agreed on the phone. She goes, "Yes, when you described yesterday on the phone, the urinating all over, and
Yeah.
especially he wouldn't even get up anymore, and he would just pee all over himself, that I was going to reach out to you and say, Nita, bring him to the office because I think we should have a bigger look at this." And then, but now that you've called me on your own, and I, because I learned so much from all of you going online, I did not know this before, but I told my veterinarian I'm not bringing him in to
Yeah.
have him, and I'm not going to use the word put to sleep. I won't. I'll just say to help him transition.
Yeah.
I I'm asking you, can you come to my house, which is something that I don't think have is normal. And my veterinarians were quite surprised, but they have done it, and they said
Mhm.
absolutely we'll come.
Yeah.
And they were able to come 4 hours later, and I made use of those 4 hours. We went to the beach, we went to a restaurant, all of us with my housekeeper, and it went really smooth. Oliver knew, and for me, because there are people like you who help with this pet loss grief, because there are wonderful veterinarians that do have
Compa-
compassion and a lot of empathy, we can make this process a, a, a sacred experience
Yeah,
versus a horrifying, never can get over it
for sure. And I
experience.
think it's that's something that's actually quite popular on this side of the world, right? Is in-home euthanasias. In fact, they've now structured companies around this. They have in America, they have companies that just do this. They just have end-of-life veterinarians who go to homes. This is what they do. It's very, very
It's
special. And I've
so
always been a
beautiful.
big fan of it because, you know, a lot of animals don't love going to the veterinarian, right?
Yeah,
Even if the veterinarian's compassionate and amazing, they go there for medical treatments.
yeah,
They don't love having their blood taken. They don't love having vaccinations. Maybe they don't love exams. They can smell the fear of other things going on from other animals there with pheromones, right? They're very, very smart. Like we can't discount that, right? And to me, there's always something that's been a little cold about euthanizing an animal in the same room that the puppy just had the exam and the vaccinations. I don't like that,
oh,
you know? And
interesting.
so
Yeah,
one thing that I had helped the animal hospital that I had managed at the end there is we did some renovations and we ended up building a grief relief room. So in a very special part of the hospital where it's soundproof, the doors are closed, there's no steel exam room table. There's cozy couches, there's
yes,
cozy chairs, there's
yes.
white countertops, there's trickling waterfalls, there's plants.
Oh,
It's a peaceful, harmonious place where, you can just sit there and enjoy the last moments with your pet.
yeah,
Take as long as you need because I don't need to rush you out of the room because there's someone waiting for an appointment. Come on, hurry up, say your
yeah,
goodbye. I'm not doing that. I had enough of the dog in the waiting room in the front wagging their tail and hitting the door. Well, these
Exactly.
people have just lost the love of their life. It's not a joke. I can't. It puts me to shambles even thinking about it. I have goosebumps. And so it that's the second best case scenario, right? Is having that grief relief room for an animal hospital. That's wonderful. But you cannot say that there's no better case scenario than being able to have this process performed in the comfort of your own home, in their favorite bed, in your lap, on your favorite couch, wherever
Um,
that special place is, right? Where
yeah.
that can also be turned into a memorialization area, somewhere that's sacred forever, right? And not in a bad way, right? And I think that's a very, very, very smart decision that people make if they have that available option. They really should. It really helps with the beginning stages of grief.
Jessica, I had candles lit everywhere. I had beautiful sacred chants playing in the background. We went and got lovely flowers for Oliver. All the pets were around him. Yeah.
That's wonderful.
The
Yeah.
housekeeper, the veterinarian, and the assistant, and it was done so gently. I didn't know because this is my first experience with end of life
Yep.
to experience hospice. And I have to say something. Oliver gave me that gift because having taken care of him, no matter how painful that was to see him every day decline, I believe having taken care of him was an honor and
Yeah.
really a privilege to go through that journey with him.
I
Now,
agree.
this woman speaking like this right now, a month, is not, if I hadn't listened to you or wonderful pet loss grief counselor like Kate McGann or listened to you or a few others, I would not be right now where I am. I mean, yes. And here's
Well,
the
and
next
don't and
question.
don't forget to give yourself credit for that too. You had to make a choice at some point that this wasn't going to be how the path was going to be again. You were not going to fall into
Exactly.
that loophole. You were not going to give up love of animals and doing this again and again because it's a horrible thing. No, it is it's a rough portion of a lifetime of happiness with a pet, right? It's a
Correct.
small portion of time. And
Correct.
I do want to just, before I forget too, wanted to validate one more thing that you just said, because I'm not sure if this has been pointed out to you or other people, but one very important thing about in-home euthanasias is closure for the other pets. People don't consider, and I don't want to make anyone feel bad for not thinking about this before, because again, best case scenario, we make the best decision we can at the moment with all the information we have. But when you are able to do this at home and surround yourself in a comforting environment with all the other pets involved, they do not go through the same transition period as they do when that pet disappears from home and never comes back. It is a very different experience, a
Mm.
very, very, very deep and different experience, confusing experience for the other pets at home. So by providing them, the experience of being a part of it, understanding what's happened, understanding emotionally and intellectually what's going to happen moving forward, and that they've watched and smelt and seen the evidence, for lack of a better way to say it very bluntly, it's so powerful. Like, you've helped them jump 2 stages in grief, right? And so you didn't just provide the best case scenario for Oliver and yourself, but you provide the best case scenario for your whole family, you know?
Yeah, yeah. And I was, I think, also in a position where I could make these choices.
Mhm.
And I know there are people out there maybe who have partners, um, and their partner might not agree, and you want it or you don't want it, and your partner wants it. I I'm not going to go into that because I think that deserves a relationship counselor, not a pet loss grief counselor. I think that's
Yeah.
a whole different
Agree.
story. But what I do want to ask you, Jessica,
Mhm.
which is important, invariably you'll have families, you have kids, you have pets. Um, what do we tell? Let's say let's say an 8-year old. Let's talk about an 8-year old, what or a 5-year old, because there's let's say you have a 5-year old at home and an 8-year old. How do you describe such young children and explain to them this is what needs to be done? What would you say?
Yeah, this is a very tough one that really I don't have specific advice for.
Yeah,
And the reason I don't is because it's dependent on too many factors,
yeah,
right? So it depends on, what kind of human animal bond there is at home in general,
correct.
what the bond is between the kids and the pet,
Yeah,
what the spiritual beliefs are, what the religious beliefs
yeah.
are, and what kind of exposure they've had to death itself, right?
Mm,
Because if you live in a household where no one's experienced any kind of loss on a human level or an animal level, or it's just not to be talked about, like the experience you've had in the past, it's very hard to say at any age how you explain this to somebody.
yeah,
Right. So it's very, very individual. And so in those situations, when people are feeling very stuck on how to explain it, given all those variables, again, I think it's a very important time to reach out to a grief counselor
correct.
and ask those questions. Hey, here's my environment. Here's what we're, working with. Maybe my husband doesn't believe, but I do. And the kids are very close, but they don't want to, we don't want to say the wrong thing. And my husband gets mad. There's some really complex structures with pet ownership. There really is. But the one thing I do say across the board, no matter where you come from, is to try not to say things like, um, they went to sleep
Yeah,
or we're putting them to sleep,
yeah,
right? Because it causes such an unnecessary fear of going to sleep. Am I going to go to sleep tonight and not wake up? What does that even mean? What does that mean? Going to sleep is supposed to be a peaceful time where we get rest and we rejuvenate and our body recovers, not where we
great.
die, right? And so I think that's like the blanket advice I usually give is just, please stay away from using those terms, which will cause unnecessary fear and anticipation in their own lives. And, make the best case scenario answer towards your children based on what you're dealing with in that household, right?
Yeah. Would it
Yeah.
be okay to say, oh, like, for example, Oliver, right?
Hmm.
Ollie's now a star in the sky. Ollie's now one of the stars in the sky. Would that be okay for a
It
little
could be, right?
child?
That's kind of based on the spiritual and religious beliefs. What are they told about afterlife? Have they been talked to about afterlife? Do they understand? Do they even believe in an afterlife, right? What are they telling, what do these kids understand about death in general? That's step one, right? Now, is that an innocent thing to say? For sure. But usually kids will come back to you with a question. Well, but how did he become a star? How did that happen? How did he get up there? Right? So you have to be prepared for all the questions that are going to come with whatever explanation you're about to provide, right?
You're
Because I
absolutely
think
right.
sometimes don't think about that. They think about the quick excuse or explanation. And I think that's the other thing, excuses. I don't love it. You need to find an explanation that satisfies and validates your child's questions. Like you really have to put yourself in their shoes at that moment. And you're the only one who can do that best. You know them best. You know their personality, you know how sensitive they are with certain topics, you know how close they were to that animal. So you need to be very, very careful about whatever explanation you give. Be prepared for the questions that are going to come after. And that's where I kind of think it is very valuable to reach out to, a grief counselor, or pet loss support groups, or, hey, I'm from here. These are the beliefs of our household. I have a 8, 9, 10, 12-year-old, whatever the case may be. This is what I'm thinking about explaining. What are some anticipated questions that you think might come with that? I want to work through what those answers could look like so that there's not confusion or fear, or anticipation for something happening to themselves that way because they don't understand, right?
I have one last question for you,
Yeah.
and that is grief. How long can it take? How long can this grief take?
Nita, there's zero timeline for grief, like zero. People can grieve for a day, a week, 3 years, 10. There's no answer. It is such an individual journey. But I think one thing that I can say to the counter of that a little bit is the quicker that people understand and accept that, the faster they begin their grieving journey, you know, and sometimes the faster it ends as well, right? But surrounding yourself with the right people, you know, who can make you feel valid about whatever feelings you're having that day, no matter how ridiculous you might think it is. I mean, I spoke with about this before. It took me about a year and a half
Yeah.
after Thor died that
Yeah.
every single time I dropped a piece of food on the floor, I'd bawl my eyes out.
Yeah.
Crazy. My kids would come get to the point where they'd come into the kitchen, they look at me, see tears in my eyes, and go, "You dropped the food, didn't you?" You know? And it was just a thing, and it was okay. I wasn't afraid to cry in front of them or, you know, just break down in tears because I'm putting them to bed and missed when
Sure.
Mr. Thor used to lay down beside me on the floor, you know? But yeah, there's really no timeline for grief, and people who try to box themselves into, you know, it's been 6 months. Why can't I just, why am I not at the last stage, right? Usually they haven't taken the right steps to validate their own feelings or you know, get some help that they need to kind of process those feelings that they're holding inside that are preventing them from moving forward to maybe the next stage of, let's say, memorialization, right? I mean, I don't know. Am I fully done with grieving Mr. Thor just because I'm at the memorialization stage where, you know, I'm able to smile when I talk about him and you know, wake up and after having a dream and not be devastated that he's not there in front of me. Not sure. I mean, I feel like there's still a portion of grief in there where I can still shed a tear in an instant if I think about certain scenarios or things that I miss or situations, right? And I think it's just important to know it's okay to have that for the rest of time. You know, we never, ever, ever should be trying, no form of therapy you go to should ever be trying to get you to forget. That is not
Thank
healthy.
you for that. Thank you for saying that. That's so important.
So important. That is never a goal. It should never be a goal.
Thank you. That is Oliver. It transitioned a day before Thanksgiving last month, and no matter how much I tell you or my friends, okay, I'm doing well. Thank you for asking. I'm doing well. Thank you for asking. I know inevitably come Christmas Eve, for the last 16 years, he was such an integral part of the turkey dinner. I mean, Ollie, can you imagine a golden retriever? And because of what you said, Jessica, because of what you're saying, I will give myself permission. I will. If I want to go in the room and cry because I miss Ollie so much, on or if tears at the dining table come down, I will not feel ashamed. And my family is very compassionate that way because they also grew up with Oliver, and my kids are adult children, but they're coming for Christmas dinner. And I will give myself permission, irregardless of what people will think of me. And it's already been a
Absolutely.
month, and what's wrong with her, and it's all that. I'm grateful also that in my close circle, I don't have those kind of um, judgmental people in my life. But I also am not I'm not judging those that judge the ones that continue sometimes grieving
No,
and get triggered,
no,
because it's just that either they don't, most of the time is because they don't have a pet, first of all, because
they
in this
haven't, they
generation that's
haven't,
broken all the barriers. This generation
yeah.
who have pets, oh, they feel the pain, but
They
that
haven't been blessed
generation,
enough. They haven't been
yeah,
blessed with going through that journey, right? So,
yes, yes,
yeah,
I call that blessed. So either they've never had a pet, or they still, that how they were raised, and all that. I'm not blaming them at all, but then
no,
when they do pass a comment like that to me, and they go, "Come on, Nita, I've also had pets pass away," and I I say thank you very much for your opinion, and I just move away because there's
yeah,
no. I just kindly move away, gently move away
for
from
sure.
that person. Jessica, thank you so much for your time that you've given me in Toronto. It's super late for you. This is past your bedtime. I thank you so much, everyone. I highly, highly, highly recommend getting a pet loss grief counselor. If not for yourself, even for your kids, for your teenage kids, if you feel that they're holding in so much and they're not getting over it, for whatever age, even your elderly parents or the elderly or people that are challenged, physically challenged, and they've depended on their pet as emotional support and all that. Please, Jessica's number, reach her out here, her email, everything will be listed on this website. Thank you
Thank you so much,
from
Nita.
the bottom of my heart. Really, the work you're doing, it was at a loss that you had to experience that, but you turned it around and made this so purposeful.
Absolutely. Well, thank you for sharing your stories with me too and having me here today. I really appreciate it. And it just, my goal is to help as many people as I possibly can. So,
And you
having
are.
these kind of conversations and spreading the word in any way we can to help as many people as possible is all we're trying to do.
You are amazing. I want you to know that because it's not only the tools, how to get over and all that. It's also the way you speak, the tone with so much empathy and with so much compassion, and that voice itself is so soothing to continue listening to. It is already like soothing that big gap, that big hole that we suddenly
Yeah.
emptiness. Yeah?
Yeah.
Sleep well. Bye.
Thank you.